Thank you. Hello, my name is Iman Ali. I'm the social media manager at the JAMA Network. Three of the five co-authors, let me just go to the next slide. Three of the five co-authors are contract or full-time employees of the American Medical Association, which owns and publishes the JAMA Network. None of the co-authors have external or financial or other conflicts of interest. Visual abstracts are infographics that use text and graphics to convey the contents of a research report efficiently. The idea was first proposed by general surgeon and architect Andrew Ibrahim in 2015. Oh, I forgot to tell you guys. I put out a tweet from myself and from the JAMA Network that has all of our handles, Seth, mine, Andrew's, and our other co-author, and the JAMA Network. If you guys want to tweet about it, we would love it. And use the hashtag, of course, PRC9. So Ibrahim's idea was that visual abstracts would enhance science communication on social media channels. The idea was rapidly adopted, and many medical journals now use visual abstracts online and in social media channels. Oh, wrong way. In 2018, JAMA began publishing visual abstracts with randomized trials. Here's an example of a JAMA visual abstract. As you can see, it looks kind of like a poster. JAMA Network visual abstracts are now a routine part of social media promotion. This is an example of a tweet for a JAMA clinical trial with an attached visual abstract. Facebook posts look similar. In both instances, the social media post provides a standard text description of the key study finding with a link to the full text article along with the visual abstract. We designed a study to test the association between using visual abstracts in social media posts and editorially significant measures of engagement. We compared two visual abstract displays. First, a visual abstract as an embedded preview link, as shown in this slide, where clicking the visual abstract links the user to the journal website. And second, an expandable image file, as shown in this slide, where clicking the visual abstract expands the image to full screen, making it easier to read, like expanding a posted photograph on Facebook, kind of like when you open a profile picture on Facebook or Twitter. We compared two visual abstract display types with a control display, a thumbnail figure from the article, as is usual publishing practice, and is shown in this slide. The article image is also a preview link, so clicking the article image brings the user to the journal website. The study had a near simultaneous crossover design, meaning we published 3 identical posts varying only by display format, 1 minute apart in random sequence within the hour of publication. We separated each post by a minute to minimize the chance that the platforms viewed 3 simultaneous posts as suspicious activity, while also minimizing confounding by time. Each display type served as its own control. The primary outcome of the study was platform reported link clicks to the article by day 7. Secondary outcomes were platform reported impressions and reach, which are measures of how many people saw each post on their timeline by day 7, and all other engagement, which was the sum of the metrics shown in the table, most notably replies and comments, retweets and shares, and likes and other reactions. Based on the pilot data, we estimated we needed 135 visual abstracts, each shared 3 times in sequence, excuse me, to have 80% power to detect a 50% increase in median clicks. We used Kruskal-Wallis testing to detect differences in outcomes between display formats, given evidence from the pilot that the data were non-normally distributed with a high degree of right skew. We pre-specified subgroup comparisons by platform and journal title and type as shown. So what did we find? We enrolled 205 randomized trials with visual abstracts across 12 journals. Over half the sample came from JAMA Network Open and JAMA. Link clicks with preview visual abstracts were greater than with other display types, a statistically significant difference. Impressions, reach, and engagement with expandable visual abstracts were greater, also a statistically significant difference. In analyses by platform, the increase in link clicks with preview visual abstracts was observed on Twitter, but not on Facebook. And the increase in reach and engagement with expandable visual abstracts was evident on Facebook, but not Twitter. When comparing JAMA to the other JAMA Network journals, the differences in the three outcomes were all statistically significant, but the relative increase in median link clicks with preview visual abstract display was higher for JAMA than for non-JAMA journals. The relative increase in median impressions and reach with expandable visual abstracts display was observed in both journal categories. We compared findings for JAMA and JAMA Network Open, the two general medical journals in the JAMA Network, with the network's other specialty journals. Median link clicks with preview visual abstract display were increased at specialty, but not general medical journals, and impressions, reach, and engagement increased with expandable visual abstract display in both journal categories. Lastly, we compared JAMA Network Open, the network's fully open access journal, to the rest of the journals which are hybrid or not open access. There was no statistically significant difference in median link clicks with preview visual abstract display, although expandable visual abstract display again appeared to perform better than article image display for increasing impressions, reach, and engagement in both journal categories. So how do we interpret the findings? It seems clear that visual abstracts were associated with an increase in social media activity, with preview link display associated with more link clicks and expandable visual abstracts display with more social media reach and engagement. The association with link clicks appeared stronger on Twitter than Facebook. The findings provide evidence that visual abstracts generate user interest on social media channels, but with differences by display format. Preview link display seems to be better at getting users to journal websites with possible benefits as shown in the slide: more full text reads, potential citations, and greater ad impressions. Expandable visual abstracts seems to be better at generating user engagement with possible benefits of greater information dissemination, extending brand reach, and organic growth in followers that come from platform visibility and sharing. Of course, there's no need to choose between formats, but editors and publishers can use both over time to accomplish both sets of goals. Oops. This study has limitations. The posting of 3 sequential, nearly identical posts helped us eliminate confounding by time, but is artificial and unlike any standard social publishing practice. The platform's algorithms are opaque and proprietary, and we cannot know for certain if they treated multiple similar posts differentially, though the random sequence design theoretically mitigated that risk. We observed differences in outcomes between Twitter and Facebook, so the findings aren't generalizable to other social media platforms. And our metrics can be thought of as surrogate outcomes. We do not know the long-term ultimate effects on measures of greater editorial and clinical significance, such as citations, clinical practice, and patient outcomes. Nevertheless, we can conclude that the use of visual abstracts to promote randomized clinical trials on social media is associated with an increase in social media-driven traffic and in measures of social media engagement compared to conventional article images. The associations differ by display type and appear to be more prominent on Twitter than on Facebook, and may vary by journal, title, and specialty. Thank you. If you have any questions, let us know.
Thank you, Ima. Perfect timing there.
Thank you.
Okay, do we have any questions? Yes, I see.
Yeah.
Ah, here and then at the back there.
Okay. Thank you, Anna Marušić, Croatia. Thank you for this study. I think it was very difficult to make it so many compounded things. And it's really from a point of view of journal editor, these results are really great. But as you said, one of the limitations is, does it really have an effect on public health, on patient outcomes? And I think this is something that would be interesting to test. I don't know whether you have any ideas with it. For example, we did a trial with Cochrane plain language summaries and infographics. Cochrane was very much into infographics and showed that everybody liked infographics, but when you actually test the knowledge, a well-written plain language summary was better than infographics, and even more when you have a block shot of 3 lines of information, that was even better than a plain language summary. So I think it's important to have in mind the actual impact on health of these things. Do you have any idea of how to methodologically deal with that? Yeah, it's very difficult.
No, methodologically, no, I don't know how to deal with that because what we're dealing with is kind of we're looking at the visual abstract as a product.
Mm.
And so from my perspective as a social media manager, my goal is either to drive traffic to our website, to get people to download papers, to read articles, to eventually cite papers, or to read and share the visual abstracts. So, in order to be able to test that's a whole other study in and of itself, to be able to test, what people are actually retaining from reading, an infographic like a visual abstract. But like I said, it looks like a poster to me when I first saw them. And, I don't know if my co-authors are actually in the room, and if they have anything else to add, I would invite them
We can discuss
to the
later.
mic, or you guys can talk to them later.
Thank you. It was back there and then over there.
Sure. Hi, Mark Richards from BMJ. We also love infographics. So I just wanted to clarify 2 things. So you didn't sort of see an observable difference from sort of hybrid journals and open access journals that had sort of visual abstracts. I just want to check, is that definitely not because the articles that were published in the hybrid journals might have been made open access or free to read at all? Because often if the effort of perhaps an infographic being created for an article might have sort of impacted.
So if I understand your question, you're asking about access
Yes,
to the article.
yeah.
So everything that we post on social media is free access.
Mhm.
So all of our articles, anything that we would have posted on these articles would have been open access anyway. We create toll-free links for every article that goes onto social media. So I guess that would eliminate that issue.
Yeah, sure. And then the other sort of question is perhaps maybe not in your room, but around sort of fairness, because sometimes we often feel there's lots of authors want infographics for all of their articles, and if they're demonstrating sort of more click-through and sort of engagement, how can we kind of make sure that's sort of fairer and we offer that kind of.
Can you
resource
repeat the
for authors?
question?
Are you asking how you can be sure that you're fairly treating authors, that you?
Yeah, because infographics we know are kind of
choosing
highly
some authors to
impactful.
promote and not others, I think.
Oh, well, no. So, you mean with infographics?
Yeah.
With the visual abstracts.
Mhm.
So I guess the rule at the JAMA Network is that every RCT gets a visual abstract.
Mhm.
So if an article doesn't have an RCT, it wouldn't get a visual abstract. Is that?
And do you tweet everyone, I guess?
Oh, yeah, we
Yeah.
do. We
Yeah,
do
yeah.
tweet every research article gets tweeted.
Okay, no,
Yeah.
thanks.
Yeah,
Yeah,
yeah. We
just-
don't, I mean, that's another conversation, but yeah, every research article gets tweeted and posted on Facebook and LinkedIn.
Thanks. Cheers.
Thank you. Okay, over here.
Hi, I'm Jayashree. I lead the author community at Cactus. Very fascinating, very close to me, because it's one of the challenges I face too. I see Twitter as a living, breathing giant that
Mhm.
I'm trying to poke and wake up and pay attention,
Mhm.
stand up and give me some attention. And I know it's really tough. I was curious to know if, along with the experiment where you posted thrice, did you also experiment with the content of the tweet and with the hashtags? Because for Twitter and social media, usually that is something that either makes or breaks your case. Did that work? So when you were posting the visual abstracts, was it just the abstracts? And what did you do to sort of, because we're seeing that increased engagement. So what was the content of your tweets?
So the content was what we would have normally posted anyway. And actually, that was something I thought about. I don't know if I brought it up in the meetings, but something I did think about, we did like some of them did have hashtags, some of them had mentions. And I'm just saying anecdotally, they do perform differently on whether they have mentions in them. So it would be interesting to go back and look at the
Yeah.
data and see how the ones that had hashtags, the one that didn't have anything in them, to see how they did against one another.
Yeah,
I mean, I guess in a separate study, it does obviously make a difference, you
Yeah.
know, but we didn't study it at the time, and it would have added another layer of something to study. Like, it would have just, I think, made it more complicated, but we didn't. Every post was exactly the same, except for the visual abstract display.
thank you.
Mhm.
Thank you. Do we have any virtual questions?
Woohoo.
We're good? Okay, great. Okay, I think then if there are no more questions, we'll move on to our second talk.